Quality improvement at Chaparrell Hospital. Quality improvement consists of systemic and continuous actions that lead to measurable improvement in healthcare services and the health status of targeted patient groups. The purpose of Quality Improvement Plan is to provide a formal, ongoing process by which the organization and stakeholders utilize objective measures to monitor and evaluate the quality of services, both clinical and operational, provided to the patients. The Quality Improvement Plan defines and facilitates a systemic approach to identify and pursue opportunities to improve. Healthcare facilities should create improvement plans in the healthcare system to engage in primary healthcare practices. Quality improvement activities are essential to improving the health of a population, patient experiences, and outcomes. It also reduces the risk of patient infections and reducing mortality rate while improving provider experiences and quality health systems. The healthcare system for Chaparrell Hospital Quality Improvement Model includes 4 key principles to support successful initiatives. First, focus on delivery system and process. Second, focus on patients. Third, focus on theme-based process teamwork as the main key for the successful organization. Focus on the use of data both in the sense of quantitative and qualitative data collected in healthcare facilities for the staff and for the patients. To satisfy the patients, we have to focus on aspects of patient-centered care, patient empowerment, patient engagement, and patient experience. Patients are complaining about the emergency room services. There's a delay in lab results and diagnosis, along with inpatient prescription services taking abnormally long amounts of time. Referrals for follow-up care is also taking longer than necessary, and unpredictable discharges and lengthy delays are roadblocks for efficient patient flow. One solution would be to create a space for almost done patients. They can go there to wait for their lab results, their referrals, and their prescriptions. It will also open up rooms for new patients. To increase patient experience is a systemic approach to prescription and referral process. Develop a nurse monitor system to monitor and signal when patients meet the goals for discharge, need for referrals, and scheduled follow-ups. This nurse monitor system will alert when staff should be ready to complete the discharge process. These processes will ensure accurate and timely reports, diagnosis, communication, and discharge. In turn, it will free emergency room space for new patients. Patient-centered care must have an active partnership among patients, their families, and their healthcare providers. Care is based on shared responsibilities and the relationship among patients, family, clinical chemistry, decision-making, and ethical behavior. Families and friends of patients are considered an essential part of parent-patient rights, including information sharing and sharing decision-making. Healthcare literacy and appropriate interactions are essential. Also, by arranging doctors' duties and staff arrangements, we will improve the quality of the healthcare systems. Communication is essentially critical as healthcare providers of different disciplines and training levels transition care, and breakdowns are causing preventable medical errors. Introducing daily doctor rotations will ensure communications with patients and staff, and by assigning the appropriate and qualified staff, will in turn provide more efficient health care and better patient experiences. Many people are concerned about whether they will get the care they need in a quality improvement system focused on cost control. Doctors also feel the stresses of offering quality care with a cost-effective approach, and while this is a key factor in developing quality improvement, patient care is also a main focus. So using a quality improvement plan will balance the needs and concerns for both cost and quality care. This information sheet to give to the CEO and Board of Directors is the information I have collected from patients, from conversations with patients and their family members. A quality improvement plan will ensure a cost-effective doctor-patient approach to satisfy all areas of concern. Thank you.